Welcome again to our psychopharmacology class. My name is Ngozi Kaonyachonam. Today we shall be talking about patient teaching tool. And for the patient teaching tool, the drug of choice today is sertraline. So we shall be talking about sertraline. What is sertraline? Sertraline is a generic name for the drug that is used in treating some psycho behaviors. And then, what is sertraline? Sertraline belongs to a medication class of SSRI. And what does SSRI mean? It means selective serotonin reuptake inhibitor. So this medication is used for the treatment of certain disorders like OCD in people. It is used for treatment of PTSD, premenstrual dysphoric disorder, PMDD, social anxiety disorder, and panic disorders. But before you use sertraline, you must consult a doctor, and it's given under prescription. When you're taking sertraline, you have interaction with alcohol. So how does sertraline work? Sertraline works by increasing the levels of mood-enhancing chemical called serotonin in the brain. How does it affect the brain? It increases the amount of serotonin in the brain. This is a hormone that helps to regulate moods. It belongs to, the medication may be used for other purposes, but before you do that, you have to ask the provider if you can use it for other purposes. How does sertraline work? It leads to reduction in anxiety symptoms, self-reported improvements in people with mental health within 6 weeks of use. But it's effective on depressive symptoms more. So how do you use it? The dosage is usually written on the label, and the healthcare provider will explain to the patient on how to take it. And taking with food when you're taking sertraline. Most patients take sertraline twice a day, and they say they feel better when they take it, that their mental health overall has improved compared with those taking it once a day. What does sertraline do to a person? It helps many people recover from depression, and it has few unwanted side effects. It really doesn't bring people down. So when you're taking sertraline, the side effect is low. And what is the efficacy of sertraline? The rate of remission at endpoint, as observed, was 31% of sertraline versus 18% of placebo, while the person is in remission state. So, what are the side effects of sertraline? The side effects could range from nausea, diarrhea. Some people have breathing issues, mood changes, seizure, problems with memory. But if you experience swelling or behavior changes or panic episode, please call the doctor. You need help as quickly as possible if you're using sertraline. Sometimes some people fear that sertraline can make you gain weight. For some people, it might make them lose weight. Some people are less hungry when they're using sertraline. Some people are more hungry when they're using sertraline. So it depends on individuals. So it all depends on the person's body comportment. Some people can lose weight, some people can gain weight. And then some people that have anxiety have reported that the use of sertraline has reduced their anxiety level. And then they continue using it. So as regards the issue of appetite, it decreases some people's appetite, some people it increases their appetite. So it all depends on the individual. And when you're taking sertraline, you cannot take alcohol because sertraline alone plus alcohol you will make you get very sleepy. So the best thing is for you to avoid alcohol when you're using sertraline. Sertraline is metabolized, at least in parts, by the liver. So when you're using sertraline, you have to be careful to avoid drug to drug interactions. And sertraline works by increasing the activity of chemical called serotonin in the brain. And this medicine is only available on doctor's prescription. So before you use sertraline, kindly seek the doctor's advice. Along other side effects that sertraline poses, it can cause temporary hair loss in some cases. Some people they might not have hair loss, but some people might, but most times you have temporary hair loss. So before you use sertraline, make sure it is prescribed by your doctor. Thank you very much for listening to me.